Hi, my name is Karen Manuel, and I'm going to be speaking to you today about atrial fibrillation. Here's a short video explaining how the blood is pumped through the heart and what happens to the blood when atrial fibrillation occurs.
Your heart is a muscle that pumps blood around your body. It's made up of 4 chambers, 2 at the top called the atria, and 2 at the bottom called the ventricles. Your sinus node sends out electrical impulses. Atrial fibrillation, or AF for short, is when other areas of the atria send out electrical impulses too. These irregular impulses cause the atria to twitch. When this happens, blood isn't pumped out effectively, which could cause a blood clot to form. If this clot travels to your brain, it can lead to a stroke. When your heart isn't pumping blood properly, it can lead to symptoms such as tiredness, dizziness, or feeling faint, shortness of breath, or palpitations. How AF affects you will determine the treatment you need. Some people with AF, like Harry,
During atrial fibrillation, the atria, or the 2 upper chambers of the heart, are out of coordination with the ventricles, or the 2 lower chambers of the heart. The major concern with atrial fibrillation is the formation of a clot that could travel to the brain and cause a stroke. Some conditions that contribute to atrial fibrillation are hypertension or high blood pressure, myocardial infarction or heart attack, coronary artery disease, abnormal heart valves, overactive thyroid gland or metabolic imbalance, exposure to stimulants such as medications, tobacco, caffeine, and alcohol, sick sinus syndrome, which is an improper functioning of the heart's natural pacemaker, lung diseases, previous heart surgeries, viral infections, stress due to surgery, pneumonia, or other illnesses, and sleep apnea. People who are predisposed to atrial fibrillation are Caucasian, obese, have a history of hypertension, and are male. So how is atrial fibrillation diagnosed? The primary tool for diagnosing it is the ECG, or the electrocardiogram. This is when electrodes are attached to the chest and they sense the electrical signals of the heart. The Holter monitor is similar to this. It's a portable ECG that is worn and records the heart's activity for 24 hours or longer. In the event recorder, a portable ECG is worn for several weeks, and the person who is experiencing a fast heart rate or shortness of breath or dizziness, they then push the button to record the electrical activity of the heart. This shows the heart rhythm at the time of the symptoms. With an echocardiogram, this test uses sound waves to create moving pictures of the heart. This is a non-invasive test. Other tests would be blood tests, and this is more of a rule-out test, and this determines if there are other conditions that may be causing the atrial fibrillation, such as thyroid problems or substances in the blood. The stress test, this involves running on a treadmill while the ECG is in place, and then the chest x-ray is done to have images of the heart and lungs to determine if other conditions may be contributing to the signs and symptoms of atrial fibrillation. So some ways to reset the rhythm and rate. The first one is a cardioversion or electrical shock to restore the heart to a normal rhythm, or the use of drugs to restore the heart rate to a normal rhythm. Some medical procedures or surgeries. The first would be a catheter ablation. This is when a tube is inserted into the blood vessels and threaded to the heart, and a radiofrequency energy is used to destroy the tissue which is causing the AFib. The maze procedure is similar to this, but this requires open heart surgery, and this is where the provider would scar the tissue in a pattern to interfere with the electrical impulses that are causing the AFib. And then the Watchman, which is a minimally invasive procedure, and this is actually just to reduce the risk of stroke by reducing the blood clots that escape. This does not change the irregular heartbeat of AFib. Other areas with treatment of atrial fibrillation would be concerning underlying conditions that may be causing the atrial fibrillation. But the main concern with atrial fibrillation is to prevent blood clots from forming. The lifetime risk for developing atrial fibrillation, or AF, is 1 in 4 when older than 40 years old. If one parent has a history of AF or atrial fibrillation, then the odds increase more. If both parents have a history of AF, then the odds to have atrial fibrillation increases even more so. The recent genetic studies of atrial fibrillation suggests that up to 30% of people who have atrial fibrillation may have a relative with the same condition. Atrial fibrillation is a complex disease, and many of the variations of the genes offer a modest contribution to the risk of developing the disease. This disease follows the common disease, common variant hypothesis, which means that the variants that are common and cause the small changes to the genes are also responsible for the majority of the disease being heritable. There is continuing research in the field of genetics and atrial fibrillation. The hope is that one day genetic testing may be possible in order to determine one's risk factor for developing AFib, and there are plans, hopefully, to prevent the disease from occurring or to manage once the disease has manifested itself. Atrial fibrillation is not determined by genetics alone. There are many ways to prevent AFib from manifesting itself. Some of the ways you can prevent atrial fibrillation is to eat a heart-healthy diet, increase physical activity, avoid smoking, maintain a healthy weight, limit or avoid caffeine and alcohol, reduce stress, as stress can cause heart rhythm problems, and use over-the-counter medications with caution, as some cough and cold medications may have stimulants that can cause a rapid heart rate. As you can see, atrial fibrillation is a disease determined by genetic factors and one's lifestyle. You may not be able to prevent AFib from occurring, but following the suggested lifestyle may postpone the disease from occurring.